Hello and welcome to internal training session for MIDI 7. Today's topic is triage. First of all, I'd like to acknowledge organization that developed this presentation in the first place. This organization was formerly known as Medicare Locals. Okay, what is triage? Triage is patient prioritization on the basis of where resources can be best used or are most needed. In other words, who needs to be seen first, who needs to be seen second, and how urgently or how soon person that presented at the reception desk or over the phone to our reception staff, how soon that person needs to see a doctor. And when we talk about triage today, we're talking about practice staff, we're talking about reception staff, practice managers. What are the issues surrounding triage? Well, first of all, reception staff doesn't have clinical skill, was not formally trained to perform triage, as probably practice nurses have been trained to perform, or GPs. Yet, reception staff are the first to see the patient. When patient come to the practice, first person they see is a receptionist. Hence, the first triage, is always performed by reception staff. They place great responsibility on triage on reception staff to perform triage. There are also some legal considerations. There was a legal case that showed that yes, reception staff has to be trained, and it is our responsibility, as a practice, a responsibility to continue training staff in triage. As I said before, the bottom line of triage is: does the patient need to be seen urgently? In the general practice context, the responsibility of reception staff is to prioritize the allocation of appointments safely and to alert clinical staff to people who possibly have a serious medical condition. How do you feel about this? Well, probably for those who get this training for the first time, probably they feel overwhelmed, because taking such a huge responsibility is not always easy. How triage is regulated in the standards for general practice. We have a standard 1.1 that practice staff need to be able to quickly and accurately identify patients' needs for urgent care as well as not urgent, complex, planned chronic care and preventive health care consultation. Administrative staff members of the practice team require appropriate triage training, and that's exactly what we're doing today. The receptionist role is great. At no time is the receptionist role of great importance that in emergency. These have no respect for appointment systems or doctors' consulting hours. It is most important for the receptionist to observe the patients carefully. It is, to say the least, bad advertising if a patient drops dead on the way out of the premises. Be able to sort priorities and distinguish real priorities from cases of unnecessary panic. Be able to reassure and manage the panicking caller until help is available. This is very important, isn't it? Yes, this is extracted from RSCGP publications. If we stop for a moment and think how appointment system works at our practice, we realize that our reception staff learns the doctor's capacity and doctor's habits in terms of appointments. We learn how they take calls, we learn how they take messages, and of course we have to utilize this in the process of triage. The system must be kept under constant review for effective utilization. The receptionist should have the role and limits of responsibility clearly defined, and if in doubt, the patient should always be given the benefit and the matter referred to the doctor. The receptionist guidelines should be adequate and kept up to date in the practice manual. What does it mean? It means that if in doubt, call the doctor. If in doubt, disturb the doctor, interrupt the doctor, interrupt doctor's consultation or nurse consultation if in any doubt about the patient that has presented in some way, in some concerning way. Which patients are at high risk? All children under the age of 2 years. Any patient looking acutely unwell. Any patient describing their reason for attendance. Chest pain, abdominal pain, breathing difficulty, severe headache, back pain, agitated patient or parent or carer. Which patients are at higher risk or distressed for any reason, actively vomiting, actively bleeding, feeling faint, light-headed or sudden loss of quality of sight. Any patient whom reception staff are concerned about. The last line really appeals to common sense. If you're worried, it must be for good reason. So, triage means that we need to establish if the patient has an urgent problem, finding out what is wrong with the patient, find out symptoms, ask questions to figure out the priority, decide on outcome, negotiate and agree to a time frame of when and how patient is going to be seen, reviewing or revising if necessary new symptoms, change in condition. Well, when patient came to reception desk and everything was okay, but then suddenly patient started to feel unwell, we have to review because there is a new condition, there is a new change. Strategies of triage are divided to 3 areas. How do you triage patients over the phone? How do you triage patients that are already in the waiting room? And how do you triage patients that just have approached? Telephone calls. Who called us? Is it patient himself or herself? Is it a carer? Or maybe it's a third party, a neighbor. We have to take that into consideration. We have to listen. We have to question. We have to have leading and probing questions. We have to feel anxiety level of the caller. In the waiting room, we can observe the patient because we can see them. We have to constantly monitor the waiting room and focus on people. And remember, who are the people of high risk? For example, children under 2 years old. In practice, sometimes we have to ask practice nurse. We have to ask for practice nurse's opinion. We have to ask for another person next to you, We have to communicate. In other words, especially if in doubt, we have to communicate. We have to make decisions together if we have a chance to do so. So ask for advice. Don't hesitate. Many lives have been saved by experienced frontline personnel taking the time to listen to their patients, particularly when the majority of initial contact with the practice is by telephone. Ask questions to clarify exactly what the patient means. Experienced receptionists recall receiving calls from regular patients who merely state, "I'm just not feeling well," suddenly. The key word there is suddenly. We have to pay attention to that, suddenly. It is only after the patient is prodded with further questioning they divulge that they are experiencing chest pain and difficulty in breathing. When patient approaches the reception desk, look at the patient carefully. A skilled receptionist can simply ask the patient to come into another room while a rapid assessment is made, and then, by knowing what the practice policy is regarding emergency situation, act accordingly. Call practice nurse. Practice staff should be aware that they can interrupt the doctor or practice nurse if they are unsure or concerned about the patient. It is far better to settle on the side of caution. Again, if in doubt, interrupt the doctor, interrupt the nurse. We have the tool that you can see placed near each telephone and on a wall behind you, or somewhere near the reception desk, around the reception desk. It is preferable that this tool is placed next to each telephone, so you can quickly refer to this tool while taking telephone call from the patient. You can see that all categories of emergency or all calls can be classed. There are 6 classes or 6 categories of conditions. Category number 1, red, allergic reaction, breathing difficulties, chest pain, choking, collapse, semi-conscious, fitting, head injury, heart palpitations, spinal injury, trauma, uncontrollable bleeding. Call ambulance. If there is a caller, if it happens to someone who calls you on the phone, call ambulance for them or advise them to call ambulance if they can call ambulance. If patient with any conditions listed under number 1, in column number 1, if that patient approached the reception desk, alert GP immediately. This is better side of category 1. So, category 1, allergic reaction, breathing difficulties, chest pain, choking, collapse, semi-conscious, fitting or having a fit, head injury, heart palpitations, spinal injury, trauma, uncontrollable bleeding. We need to advise patient to dial 000, or if patient is present at the practice, interrupt GP, interrupt practice nurse. Category 2, abdominal pain, bleeding, burns, limb numbness, loss of speech, unable to urinate. Telephone advice: go to emergency department. What to do if patient is present at the practice? Interrupt GP. Category 3, bites, eye injuries, injured limb, meningitis, poisoning or overdose, psychological distress or patient in danger, lacerations, severe pain, pregnancy problems, pain or bleeding, ruptured membranes, reduced movement. Discuss with GP or nurse now. Well, it means you will have to interrupt GP or nurse. Category 4, abuse or assault, meaning that there is a victim of abuse or assault in front of you. Back pain, extremely anxious patient or carer with extreme concern. Oh, you can always see that. Swollen limbs, underdose, visual disturbance. Discuss with GP or nurse within 30 minutes. Category 5, rash, unwell child with persistent fever, vomiting, diarrhea, persistent cough, other symptoms. Come to surgery now. And finally, category 6, eye problems or earache, fever and adult, otherwise well, limb pain, post-op problems, urinary problems, but able to urinate, wound infection, pardon me. Make an appointment today if possible or within 24 hours.